welcome. Thanks for joining us. This is Dr. Carla Smith. So welcome. Thanks for doing this with us. So just to start out, why did you choose orthopedics?
I chose, so kind of a funny story. I had decided urology was the right specialty. I had my away rotations set up. I had my applications in, and a good friend of mine that I was racing with on bicycles kept exhorting me to try out orthopedics, and I just said no. I believe the stereotypes. I didn't really want to be around that or part of that, and she was extremely persistent. So I did an away rotation, actually Denver General, on the 4th of July, and I realized this is absolutely too much fun not to do. And I went back to Baylor and canceled my away rotations and all of my early match urology applications, and told my PhD advisor I was going to go into orthopedics, and it was absolutely the right decision. I owe her tremendously. I think I would have found it, but I think it was her persistence that really opened my eyes, and it's been the right choice all along. And furthermore, trauma was the exposure, and that's where I've ended up. So it was a willingness to change even when you thought you had already committed.
Awesome. So did you always think ortho trauma then, or did from that point, or
no,
what made
that
you
was
that?
that was non-conventional after the fact. I really didn't know. I started residency thinking academics, and that changed. And then I kind of, even into my 4th year, I just wasn't sure. I wanted to go overseas and do some things. I thought peds, didn't really know. And then as it got closer and closer, I sort of realized that trauma was fun, and I couldn't really imagine not doing it. I think my default would have been general practice and no fellowship, but I got really lucky and ended up coming back to Harborview since I had trained at University of Washington, and I did some overseas fellowships and some overseas experiences, and then I did go into practice. My first 5 years was general, so I did everything, and then I kind of reached a decision tree where I decided I'd rather stick to more trauma and switch jobs so that I could get rid of the bunions and the total joints and the other things that were, it was good to do. It was fun. Maybe someday I'll do them again, but it was really more fun to do all trauma.
So how did you get involved in overseas work and your mission work? Because I know that's a big part of who you are and what you do. So how did you actually get started in that?
I did a combined MD PhD program, and the way it was constructed, I had about 8 months in between the completion of my PhD before I could rejoin this kind of the cycle for rotations. And during that period, I did a postdoc in Japan in a pharmaceutical company, and then I did some traveling in Asia. And I think it had been on my radar. I had sort of thought about it prior, but I was in Tibet at the same time as a group with Doctors Without Borders, and it was really fun to watch the dedication and the commitment that they had. And I count myself lucky that I actually found the right organization to promote education as well as network and fellowship, rather than that particular model. But that was sort of when I said, I'll be back, and I'll sort of figure out the way in which I'll be back. And then that actually started in residency when I met Lou Zirkle. who at the time was just starting to, he had worked with Orthopedics Overseas, which is a division of Health Volunteers Overseas. And then he was starting an implant company. And so I've actually kind of since that time maintained connections with both of those. And, they're kind of complementary. One is more production of the implant and the kind of database of its use and the surgeon network created, and the other is really education driven and kind of empowerment driven. And so they really are complementary organizations. And so I've stayed involved with both of them throughout.
Awesome. So what's the most rewarding part of your job as an orthopedic trauma surgeon?
It's the patient. It is, and it's not even what I do, it's listening. It's being present. And I think as I've sampled a few other things, administrative positions, looking forward to whether I can continue to do big cases and operate all day and be up at night for 20 more years. I think about administrative jobs, and I just know it's when it's being with someone when they cry. It's giving them hope. It's helping them through a tough time. And then sometimes it's celebrating when they get back on their feet, when they get back to their lives. And I think I have a couple of patients from my residency that I still keep in contact with, who had, one was in a plane crash, another was a kind of a horrific car accident. And every so often that little update about what they're doing with their lives is just like, that is the most rewarding. That is why it's all worth it. It's not the cool x-ray, although I'd be lying if I said that wasn't part of it.
Definitely. Awesome. So how did you get involved in the AO?
My residency program was very, I'd say, AO representative. A lot of faculty were AO faculty. We were, that was the perk of going to AO courses. And I think there was that same element of dedication and commitment that I saw with Medicine Sans Frontières, that it was betterment for the sake of betterment and camaraderie, and really in the end it was about doing the best thing for the patient. And that's kind of intoxicating. And I think there was certainly a sense of mastery and accomplishment to be able to complete courses, but then also to discuss principles. Ted Hansen was my faculty sponsor, and it was sort of like, probably a little like joining the club, but the club was about not just being in the club, but doing something with it. And I think that's what still keeps me engaged, is the coaching program, the education commitments, the sense that we're creating something bigger and we're part of a community that's values that.
Awesome. So who do you consider your mentor?
It's a long list.
Good. Let's hear it.
So one of the people, my PhD advisor, William Shearer, was a pediatric immunologist at Texas Children's Hospital. And when he died a couple of years ago, there was actually a segment on NPR because he was the physician for David, the bubble boy, the original patient with severe combined immune deficiency that underwent novel treatments. And there were so many things about his dedication, his demeanor, his willingness to think outside the box that though I didn't really follow his footsteps in academics, I still think of as inspiring as sort of his lasting impact on me. There were so many people in the lab who similarly, in both men and women. Certainly in residency, there are lots of people that I think of: Chip Rout, Bruce St. Jorzen, Doug Hannell, Bill Mills. Lots of folks who were fellows at the time, were residents at the time. Lou Zirkle has to stand out as, certainly somebody inspirational, somebody whose, continued involvement is really meaningful to me. Nancy Kelly, who is the executive director of Health Volunteers Overseas, and actually probably one of the biggest reasons for its success, has really been a mentor to me in that space and in overseas things. I'm sure I'm leaving out a lot of people.
Oh, that's a great list.
But it's a long list.
Yeah. What advice would you give someone that wants to go into orthopedics?
Do it. It's been fantastic, and especially do it if you're female and you're Latinx and you're LGBTQ plus and you're anybody that you don't see currently, because I think we really need the diversity. One of the things that traveling the world makes you realize is that there are great ideas from everywhere. And oftentimes resource poor, places force you to have greater ingenuity and, skill, frankly, to get the same results. And so, I would encourage everyone. I think it's, I will freely admit I had stereotypes that made me think it wasn't the place for me. And I would say, ignore that. If it's of interest to you and it's what you want to do, do it.
I think that's great advice, because you're probably like me. I can't imagine doing anything else. So I think that's wonderful advice. What about orthotrauma? What advice would you give if you're thinking about orthotrauma?
Same. I think it's evolving. I think in the course of my career, there are more options than there used to be. I think there are a lot more of us, whether that's right-sized, good or bad, is beyond our scope here. But I think there's lots of ways that you can do it. I think and there's lots of environments that you can do it that don't require quite the toll. The all night, the access to the OR, the more and more communities are supporting having quality educated, resourced folks, recognizing that it makes everybody else more efficient if you are taking care of the increasingly complicated, complex, and sicker folks that are coming into ERs. And I think that's, the question I often get is, can you have a family and do this and have other interests? And I always say, sure, you figure it out. It's not maybe always at the same time, but you can, there are infinite possibilities. And the probably the biggest mistake I think that I see people making is assuming they have to do it the way someone else did it. There's infinite, your career is different than my career, is different than somebody who came before me. Carol Teitz was another person I would consider a mentor. She was one of my faculty. She went on to become the Dean of Admissions for University of Washington. And I've worked a lot with her through admissions over my time on that committee. And, she's somebody who did it differently. She chose a different path when that really wasn't even as popular as it is now. But I think it's, you're only limited by your own creativity. The other thing I would say is don't be afraid to take time off. We get programmed and you think, well, I have to do residency and then do fellowship and then get the job, and you can experiment. There's, the day I had to call Johns Hopkins and tell them I wasn't coming for my away rotation in urology was kind of a rough day, but it was the right thing. And if I had just stuck with it and thought, life would have been different and I would have been, much sadder. So I think it's okay to change your mind. It's okay to consider. It's okay to find your own pathway.
Great. What's your favorite case? Like, what's your perfect day if you come in, and what's on the board, and what's your all-time favorite case to do?
The perfect day is when no two cases are the same. I think that's what drives us with trauma. Right. I have to say that a complicated elbow is one of my favorite. I think, I'm not, if I had an entire day of calcaneus fractures, I might not look forward to that day quite so much. But I think that no two cases being the same, something that makes me think it's really fun after 20 years when you think to yourself, I've never seen this. This is different than anything I've seen before. And I think that's part of the beauty of trauma. It's not another hip replacement. It's something different. I think some of the kind of intraprosthetic things that are getting commoner and commoner are fun. They require you to really think. They require you to preoperatively plan, which we kind of forget to do sometimes these days. Those are fun. I think I do a lot of tibial plateaus. I think those are still fun. I think, a really nice transverse mid-diaphyseal femur fracture, which, really never comes, right? Because we get all the articular. Those are fun.
Great. Any frustrations in your job right now, or that you've experienced throughout your ortho trauma career?
Boy, I think as always, the biggest frustration is when you can see what needs to be done and you can't get it done. And sometimes that's OR access, sometimes that's insurance companies, sometimes it's the patient themselves. And I think those are, we see burnout a lot in the news. We hear people talking about contributing factors. And I think it's when you see what needs to be done and for reasons that don't make sense to you, you can't bring it about. And I think that's, that's when you have to realize not everything's under your control. You can choose to let it defeat you, or you can choose to move on and do the things that you can. And I don't think the frustrations will ever go away. There will always be limited resources. There will always be financial considerations. There will always be other people who need access to the OR as well. Especially in trauma, we're less predictable in what we are going to have on the schedule on a given day. And so I think it's kind of part of it, and how you respond to that is really where your growth lies.
And last, what are you most excited about in either ortho or ortho trauma or your career? What are you looking forward to and really excited about at the moment?
I was thinking about the thing that I'm the most proud of, like sort of in preparation for this. And one of the things that I find personally is that that is still in the future. Like the next thing will be the biggest thing, and I don't really always know what that is. But I think that, you know, one of the hats I'm wearing at the moment is as chair of the HBO board. And this has been a really interesting time for us in terms of COVID. I think the same is true of AO, you know, all of the organizations with interpersonal kind of involvements. And I think emerging from COVID, how we resume our participation worldwide is going to be a really interesting and kind of growth provoking and time that requires really thoughtful re-engagement. I think that's true of education within the AO as we, you know, leave this sort of time of no contact. What will we look like? How will we rise to the challenges of what needs to be done in person? What can be done virtually? How do we still promote education in the same way? And you know, those are going to be big challenges. And I think really opportunities for interesting conversations about the kind of core values and the things that are important in both those organizations. And I think they're right around the corner. This, you know, we'll only know we're out of it probably when we're well past it.
Right.
But you know, those are in the future, and it'll be exciting.
Well, thank you so much for this. You were my coach for my first AO course and made me feel so comfortable and really just cemented how much I want to be a part of the AO and really affected, you know, how active I am in the AO. So thank you so much. And I, as an orthopedic trauma surgeon, as a female in orthopedics, I think you're an awesome mentor for all of us. So thank you so much for your time.
There's one last thing I have to say, though.
Yes.
Thank you. And the other really rewarding thing is seeing all of the younger folks, like some of the folks that I have mentored over the years, and just being in awe. I think one of the hardest things about being a mentor is when your mentee surpasses you in every way possible. And that is hugely rewarding because you think, you know, I saw that spark and I knew that you would be fantastic, and you are. And so thank you for that reward.
Yeah, thank you. That was awesome. Thank you.